National Coronavirus Command Council has decided to enforce a nationwide lockdown for 21 days with effect from midnight on Thursday, the 26th of March.
In what was initially supposed to be a 21-day lockdown, today marks exactly 1 year since South Africa entered into a national lockdown. And it is without a doubt that COVID-19 has changed the lives of people across the world. Survivor Fadil Majid, who had been hospitalized with COVID-19 in early January, is only now beginning to drive, work, and cautiously step outside again. Power Digital editor Leila Majid shares his story.
It was a long battle, you lying there. 2 days or 3 days before New Year's Day, I was like feeling not myself. Yeah. Then 1 week passed and I started to, my oxygen level was starting to drop. We summoned the ambulance and they said no, the hospital is not going to accept me. They're just going to turn me back. They send me back home. I'm fine.
A day later, his condition had deteriorated. He was rushed to hospital.
Never in my mind did I ever thought they're going to keep me for a period I spent 20 days.
While in hospital, he spent 10 days in the COVID ICU, 6 days in high care, and the remainder of his time in the normal COVID ward. But it's his time in ICU that lingers most in his memory.
The ICU, it's like when you look at the people lying there, they were like very, very sick. Looking at them, some of them look very ill. Looks like with all the with all the drips and other parts of the machinery, they look very, very sick. And thinking, I'm with 25 other people in the ICU. That went through my mind a couple of times. And then at 3 o'clock, Petke sent the guy up to come draw blood. And he was like that vampire that strike at 3 o'clock every morning. But it's actually lonely if you lie in hospital and you don't have anybody to come visit you. It affects you. And for many of the patients, that being there, lying there, is that you're on your own. But then the most joyful moment I had, which were, like I didn't know I was going to leave at that specific time. It was a moment I will never forget, seeing 3 of my daughters downstairs. Plus my beautiful wife, Shireen, waiting there for me. And the tears was just flowing. And I was so grateful that I'm one of the fortunate ones that are living.
After 20 days in hospital, he spent the next month recovering at home, weaning himself of oxygen under the watchful eye of his wife and daughters.
It was definitely much easier because I had my wife and my daughters here to give support, and it was just in a much better environment than a hospital.
Welcoming him home was the greatest blessing. It also came with an enormous amount of uncharted territory.
It was an absolute roller coaster at the time. Because the first few nights you almost sleep with your one eye open. To make sure that the concentrator is giving him the required oxygen. He also wasn't eating well, and you needed to make sure that he eats well so that he gets all the nutrients that is needed for his recovery. He also had a bit of brain fog to the extreme where he would say that he can't remember anything. In the first few times when it happened, it was frightening.
2 months after his diagnosis, following a grueling hospital stay and a month-long recovery at home, this COVID champion is stepping outside again for the very first time.
With phase 2 vaccination not yet underway, many experts are predicting a third wave for South Africa. The South African Medical Association breaks down the past year under the pandemic and how far we have come to mitigate the virus. Power Digital reporter Thabo Chabalala sat down with the association's chairperson.
A year later, and South Africa has recorded over 1.5 million cases and over 51,000 deaths. South African Medical Association chairperson Dr. Angelique Coetzee, who is also a general medical practitioner, says government has not done enough to mitigate the virus.
If one look and listen to what the people out there is saying and doing, we haven't mitigated enough. People still doesn't understand the values of the masks.
She lambasts government for its confusing mixed messages around the prevention measures.
Especially healthcare workers. We think there is a lack of knowledge.
On the 1st of February, 500,000 AstraZeneca vaccine doses had arrived in South Africa from India. A few days later, it had been revealed that this virus was not adequately efficacious against the coronavirus strain prevalent in South Africa. Health Minister Dr. Zweli Mkhize then announced that the Johnson & Johnson vaccine would be used instead.
The Johnson & Johnson came in under the Sisonke project. The Sisonke project was the group that originally did the trials last year on Johnson & Johnson.
This has been administered to healthcare workers under the Sisonke project, a clinical trial through the South African Medical Research Council.
But they are now in the process of getting full registration. But as I said, it takes quite some time to go through that process. So now what happened with Pfizer is Pfizer got emergency approval under Section 21. They're already at that level. And it means for the next 6 months, they will have this. And while they have, in the meantime, they also need to get full registration. So once if they get full registration, whether it's Johnson & Johnson, whether it is Pfizer, it then means that the likes of Discovery, the likes of any other company who would then like to bring in vaccines into the country are then allowed to bring it in. But to get there, you actually need full registration.
The Johnson & Johnson vaccine is yet to be fully registered for use in South Africa. Phase 1 of the inoculation program seeks to vaccinate over 1 million healthcare workers. Phase 2 is for those over the age of 60 and people with comorbidities.
Phase 2, everyone above the age of 60 must get vaccinated. And then the second group would be, or in that same, above 60 normally will include your old age homes, but then also people with comorbidities. So my concern with the term comorbidities is, how are you going to make sure that that first rollout to the public, if you come to me and you say you have diabetes, say, start to vaccinate everyone above the age of 60 that wants to be vaccinated.
A lack of internet access in rural South Africa is another concern.
Also remember, a lot of people in the rural areas doesn't have internet connectivity where they are. So, and if you then go paper-based, or just being a walk-in, it means that there might not be enough vaccines allocated for that site that you want to go to.
The normal average South African will only get vaccinated in phase 3 of inoculation, targeting 22.5 million South Africans. Will we ever live in a world without COVID-19?
What's going to happen, the young generations, the under 5 years. For them, that will become part of life. For us, it's going to be a struggle. We're not used to this. And I really think only time will tell us, but at least for the next 3 or 4 years, we will have to wear your masks. We will have to have a surgery like mine, where everything stands open, where there's only one chair for only one patient to come in, where you really sit nearly 3 meters from me.
Thabo Shabalala, Power News.
The pandemic has also severely affected all businesses in the country, with one business in Tembisa still struggling to pick up. Power Digital reporter Ntako Mashaba spoke to entrepreneurs around the area.
This is Maibuye, one of the busiest markets in Tembisa. With the country now on lockdown level 1, the usual bustle is back. But small businesses are still reeling from the devastating effects of the COVID-19 pandemic and subsequent lockdown. 51-year-old businessman Michael Chauke is working with his son and complains that business has not picked up. The Chaukes make bed bases as well as car seat covers.
Business slow. I feel the business. I'm busy like before.
With the country struggling to contain the spread of the coronavirus, Chauke says he does not have an idea when the business will pick up.
I have an idea because I never have a so mintiro ya vanhu yi loko yi lahleka loko vanhu va tirha hi leswo na mina fanele ni tirha loko vanhu ntirho va lahlekeliwa hi mintirho va ta ni sapota kanjhani na va nga yi kumi mali a va yi kumi mali musi loko va tirha vanhu na mina tirha mara loko business yi slow hala kun'wanyana na mina business a yi fambi.
The lockdown has done more than impact small businesses. It has robbed thousands of families of their daily bread. Tembisa is a poverty-stricken due to high rates of unemployment. South Africa's unemployment rate now stands at a record 32.5%. The level of joblessness in the country has only been further exacerbated by the sustained lockdown. Thabo Mazubuko has joined over 10 million South Africans who are out of work due to the lockdown.
Lockdown affected us a lot, lost jobs, and they promised us too many things, but I don't see anything coming in. So even us, I was promised a UIF, but I didn't receive it. Mostly in business opportunities, because now we're looking at business opportunities. If they bring one on the board, then they'll see what we got in mind.
Another who has been severely impacted by the lockdown is Kulufelo Phahla. He is pleading with government to create job opportunities.
Lockdown, my brother, is affecting us since last year, the same month, they trained us. So, for our table, the mission for at least to follow create a mission so that our economy is our whole.
While government continues to sound the warning, encouraging citizens not to let their guards down and continue adhering to health and safety protocols, there remains little to no enforcement of the regulations. The wearing of masks in malls and other public spaces has begun to fade, while pubs, restaurants, taverns and bars are overcrowded with non-compliant revelers. Ntako Mashaba, Power News, Tembisa.
With 2021 set to also be another COVID-19 year, it remains to be seen when exactly South Africa will achieve herd immunity. The onus will not just be with the Department of Health in tackling the virus, but every single South African has a role to play in defeating the coronavirus.
Will come a day when this pandemic will be over. On that day, we must be able to look one another in the face and say, we gave it all that we had. We each played our part. We worked together as one nation and we prevailed. May God continue to bless our beautiful country and protect her valuable people.